Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Support comes from Thomas Nelson Community College, the first choice to start a bachelor's degree. Tuition is 1/3 the cost for the first 2 years of college. From there, students can transfer to one of Virginia's 4-year schools. tncc.edu.
Hello, everyone. I'm Barbara Hamley. The numbers are mind-blowing. In the United States, 1 out of every 500 people has died because of COVID. That's frightening enough. But when you look at the numbers of Native Americans, Latinx Americans, and African Americans, it's overwhelming. 1 in every 240 Native Americans died of COVID. For Latinx people, it's 1 in every 390. And for Black folks, it's 1 in every 480. And those numbers represent people ages 40 to 64 years old. Up next on Another View, cardiologist and health equity expert, Dr. Keith Newby, with the latest correct information about the coronavirus pandemic and what you need to know to stay safe. But first, guess what? It's your turn, Another View listeners, to support what you love by becoming a member of WHRO Public Media. It's our fall membership drive, and here to encourage you to join our family is Another View producer, Lisa Godley, and the best phone answerer on the planet, Dr. Barry Graham.
All right. I hold that title proudly, I promise you. Absolutely. I am here.
Absolutely. Hey, guys, how you doing?
Doing great.
Let's throw the number out there right away, 1-800-940-7170. That's the number to call to make your pledge of support, or you can go to whrv.org and show your love there.
That's right.
Lisa, you know what? I don't think is this the first time we've had a chance to talk on the air together?
Yeah, this is the first time during this pledge drive that we've had that opportunity. But we know you love us because you're listening to us. So this is your opportunity to support what you love. Don't let it pass you by. We have some wonderful thank you gifts too. I mean, I love our Another View Black Lives Have Always Mattered t-shirt.
Yes.
For you can get that for $10 a month as a sustainer. We love it when you become a sustainer. Or you can get the sweatshirt. It's starting to, it hasn't quite gotten a chill in the air just yet, but it's coming.
It's coming.
You haven't been outside today, have you? Yeah, it's dropped considerably out there as I was coming in. A little bit of a chill in the air already.
Here comes fall.
Absolutely. So, Barbara, we have a match today?
Yes, we do. For every dollar that you give up to $2,000, it will be matched dollar for dollar. So please give us a call at 800-940-7170. Become a part of the WHRV family. Join us here at Another View. We know you're listening every week, and we truly appreciate it. So why not just take that next step and really become a member? You'll listen to the show in a whole different way, won't you, Barry?
Absolutely. When you listen to the show and you know that you are a part of it, you listen a little bit differently. You can listen so proudly and think, I am the reason why that wonderful program, Another View, and the wonderful, wonderful information that is shared on that program and the enlightenment that you get from it, it's because of you. You wear it very proudly and you think, I'm the reason why I'm hearing great radio right now. I know I am a member, and whenever I tune into the station, and when I tune into Another View, I think it's because I am a member that this program is on the air. 800-940-7170. Barbara, you mentioned me answering the phones. We hear from people so often. They tell us what they think about the program. Mm-hmm. Now is your time to really tell us what you think about the program by calling.
Absolutely. WHRV.org makes it very, very easy for you to just go online. If you're listening to us from outside the area, but you want to continue to hear Another View, become a member at 1-800-940-7170 or WHRV.org. One of the things that we know is that there's a lot of misinformation out there, particularly about the coronavirus pandemic and things that are going on. That's what we're going to be talking about on the show today. And that's the beauty of this show, Lisa, isn't it? That we can make sure that people get the correct information.
Absolutely. Live to make sure that happens each and every week. So we are excited. And we know you are too because you're listening. And I just met someone, I meant to tell you this, who doesn't live anywhere near here, but listens, make sure he tunes in, via the internet to listen to Another View.
That's awesome.
Every week. And I'm like, we're touching lives and changing lives. And, I love the fact that we do that.
Absolutely. Well, people tell me all the time, it's a chance to hear a conversation I wouldn't normally hear. And so, so we appreciate that. And we appreciate each and every one of you. Those of you who are sustainers, we know that you're giving on a monthly basis. Thank you. Thank you. Thank you. We really appreciate that. Lisa's a member, so am I. Dr. Barry Graham is definitely a member.
Absolutely.
And so is Todd, who is our audio engineer. We love him too. And so we're doing the best that we can. We're almost about time to go to the show. But Barry, you want to wrap us up in the last 25 seconds or so?
Absolutely. Now is your opportunity more so than ever to say, I support what I love, and we know you love this program. How can you not? Call us, 800-940-7170. Very easy. Also, WHRV.org.
And Lisa, any last minute encouragement?
Just do it. Become a member. If you're not a member, if I run into you in the street, I'm going to ask you if you're a member. So this is your opportunity to become a part of the family. Do
I love
not
doing
let
that.
it pass
I
you
love
by.
doing that. Yeah, I do that too all the time.
Absolutely. WHRV.org. That's where you can go and make your pledge of support.
Discussing today's topics from an African American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Thank you to all of you who support our show by becoming a member of WHRO Public Media. To those of you who are sustainers, just like I am, we thank you for your monthly contribution. Membership is what keeps shows like Another View on the air. You can call it anytime during this broadcast, 800-940-7170, or go to WHRV.org and become a member. We have a $2,000 challenge this hour, which means your membership support will be matched dollar for dollar up to $2,000. Now, I also know that the Another View audience comes in at a much higher rate than that. So let's go, folks. It is now time for us to show our love of WHRO Public Media. Thank you so very, very much. And speaking of love, please welcome our favorite health expert, Dr. Keith Newby. He's a cardiologist and health equity director for Sentara, and he's as passionate as I am about keeping you and your loved ones safe during this pandemic. Hey, Keith, how are you?
I'm doing well. And yourself?
I'm doing just fine. And we know you're a member also, so we do appreciate that. Thank you very much, and encourage all your friends to become a member.
Well, I got your back, Barbara.
So listen, and then in the beginning of the show, I talked about these numbers. 1 out of every 500 Americans has died of COVID. For African Americans, it's 1 out of every 480. Now, that number scares me. Why is that not enough to convince people to get their shot?
If you can figure out, that is the $1 million question that drives me insane on a day-to-day basis. Is so, I've toyed with this concept and this idea for months now, trying to talk to people and who tell me like they don't want to get vaccinated, or they're for whatever reason. And I try my best to say, help me understand your hesitation, so I can then hopefully enlighten you and possibly have you look at things from a different perspective. But I can't. I feel like I can't really get what I need out of most people to really sway them down a different path. I have been trying my best, but I go through the numbers. I tell them, listen, the COVID vaccinations are predictable, have predictable side effects. I know the least amount you will have, and I know the most you will have. But I tell them, I said, COVID-19 is a crapshoot. You don't know what's going to happen. Yes, there's a lower likelihood you'll die having COVID-19 versus those who will go on to perish from it. Mm-hmm. But I'm like, you don't know. I mean, I think I may have mentioned to you before when you and I talked previously, I had a 49-year-old woman die of COVID-19 3 weeks ago. who had no medical problems other than she was a little overweight, and that was it, but came in on a Friday night and died Monday night and did not want the vaccine, said that she was scared of it, and now she's gone. So how do you, but because the problem is once you run into that scenario, I mean, by that time it's too late.
It's too late,
and you can't, you can't get them to see the where the path they're going down, and you're scared for them. So that's $1 million question.
This week last week there was a lot of chatter because rapper Nicki Minaj came out on Twitter and said that a Trinidadian friend of hers, had some fertility issues after taking I won't say exactly what she said, but it was related to reproduction and because of the vaccine. But it was very interesting. I read an op-ed in the Washington Post from 2 African American doctors who were saying, we need to correct what she said, but also we need to try to bring in the celebrities and all and have them talk about the real story and tell the truth, because people listen to them. I mean, people lined up at the CDC saying Dr. Fauci lied and Nikki's telling the truth. There's such a disconnect.
I know. I'm telling you, and my thing is this, and what I try my best to, what I really wish celebrities would do. To me, that's like me saying how to be an actor, how to be an entertainer, how to I don't have expert in that area and don't try to have expertise in that area. All I want them to say is talk to your doctor, because, if that's what they think is right for you, you should listen. That's really all I want them to say, because I'm like, you don't know. And I'm trying to tell, just like this issue, the one thing what people don't understand about medicine is how do you correlate a symptom with a intervention, meaning, okay, just because you got a vaccine and something happened to you 2 days later, you cannot say for sure that the vaccine caused that. That may have been something that could have happened anyway, whether or not you had the vaccine or not. So the thing is, and just like this issue where she was saying supposedly had happened, you don't know, and there's been no data to suggest that is a comparable side effect or an issue that you will see after being vaccinated. And a lot of times, unfortunately, so I've had patients that are scared enough that they've almost talked themselves into having symptoms that otherwise wouldn't have had them. I mean, it's just, and literally they almost they're so scared that they're going to grow a third arm, or whatever, that they actually believe, and they've convinced themselves that they're going to have a problem, and they subsequently have a problem. The mind, you'd be surprised how many tricks it can play on you.
Absolutely.
And again, but I tell people that I'm not, if the data is suggestive that there is a problem, I mean, I'm not going to be like pro COVID-19 vaccination if the data suggests otherwise. I'm not, but I do know data. I know how to interpret data. And that's where I'm trying to get people to understand is if you're not in medicine, you really not necessarily, you don't really know how to interpret data. So you have to be careful at what you're conveying to other people, that can impact them. So suppose you turn off 100,000 people from getting vaccinated, then 50,000 of them die.
Yeah.
I mean, so that's the part I'm trying to get people to be careful of what you say to others, because your impact may be to their demise.
It was interesting. The government official that was interviewed from Trinidad was also talking about how then their staff had to basically spend an entire day, one, trying to track down this individual, and two, then it caused people in that country not to want to get vaccinated. So once again, spreading false information is a problem. 440-2665 or 1-800-940-2240. Those are the numbers to call to talk to us today about the COVID-19 vaccine, about COVID-19 symptoms, any questions that you have surrounding this pandemic. 440-2665, 1-800-940-2240. So, Keith, this is the thing. And I understand why people get so confused because there's a ton of data, a ton of information coming at us on a daily basis about this. I mean, even doing my research for our show today, it's like, whoa, let me take a breath and figure out exactly what it is we need to know. At its very core, what are the basics that you want people to understand about this virus and this vaccine?
I think the first issue when you talk about the virus itself is that it's ever changing, and viruses, like anything else, ever mutate. And that's why, when they talk about flu shots, they have to change the flu shot every year because they're looking at what's the more likely flu bug that year, and it's based on the trends of what they see. So viruses mutate all the time. Mm-hmm. So that's the importance of the vaccination piece, because if they're constantly mutating and changing, then they can't, because, viruses, and I've said this before, I'm not sure if I said it on the show or not, but the virus has one job, and one job really only, and that's to survive. So it's looking for a host so it can replicate and take over that host and live. That's what its job is. So it's going to do whatever it can to try to live. Now, the reason the vaccine has been so effective is because, the targeted portion is necessary to enter into a cell, and that part has not really mutated but so much. Mm-hmm. But the thing is going to be, and I'm trying to get people to understand that, A, the virus is deadly, and we do know that, and it's caused not only just issues of potential death, but long-term problems. I have several patients on oxygen who have been on oxygen for over 6 to 8 months who had COVID, back when, and still paying the price for that. So there is truth to the long hauler syndrome, because I've had people in my practice who otherwise have been on no oxygen, no respiratory problems, who now have a bunch of respiratory problems. So I want to make sure people understand it attacks the lungs. That's where it harbors, because it's an airborne virus. So it's going to get in the lungs, cause a lot of inflammation, potentially a lot of damage. It may not, but a lot of times it does. And its job is to survive. So that's what it's going to do. So having said that issue, and is highly transmissible, including this Delta variant, which is more transmissible than the others. So that's that issue on COVID-19. Mm-hmm. The issue of the vaccine that I'm trying to get people to understand is everybody will say, somebody took the vaccine and they got COVID, a month later. And I'm like, that may happen. I said, no medicine. That's just like taking a blood pressure pill and you're going to get frustrated because your pressure is not under control. Sometimes you have to do more than just take a pill. Sometimes you have to change your lifestyle. Sometimes you have to do this, you have to do that. It's not going to be one thing is the savior of all mankind. And some of it is dependent on the reason why the Delta can sometimes sneak through is because when you think about it, everything about infection is how much comes into place. In other words, say like if you get one viral molecule versus a million, if it's that transmissible, that means somebody who's around you that may have the Delta variant may throw a million in you, and your body just can't catch up fast enough, even with the vaccine on point, to keep you from getting that infection. But at least it's not going from like stone cold zero. So there is an antibody response that the body's going to kick in, which is why people sometimes don't get that sick when they have been vaccinated, versus if you don't have the body has not seen COVID-19. So all of a sudden the body gets infected with it. It doesn't have a chance to try to build an antibody response before the infection takes over. Mm-hmm. So that's where the difference, if that makes sense.
So let me go back to a point that you made, though, when you were talking about, for example, if you had high blood pressure, beyond taking the medicine, you also need to change your lifestyle and so forth. Yeah. So the equation here would be taking the shot, but also masking, still staying distant, still washing your hands, et cetera.
And living right. Don't just live in fast food joints all the time. And you want to make exercise. You want to keep work on the weight, keep on your diet that you're doing, all the things that are healthy for you. Now, one of the things that people always, when you talk about the caveat that people always come up with why they want to take the vaccine, because I'm already healthy. That's got nothing to do with can you still get sick. Right. I mean, now, you're less apt to do that if you're taking care of yourself. But that's not protection for you, because again, those viral particles, once they hit, if your body has never seen COVID-19, it's not going to be able to mount the antibody response with no vaccine fast enough to potentially prevent you from getting sick. And that's what I don't care how healthy you are. Your immune response it can't kick in but so fast if it's never seen it before. That's why the vaccine is important, because at least it'll have a memory. So it'll be ready if you do get exposed to potentially fight it.
440-2665, 1-800-940-2240. Willie joins us from Chesapeake. Hi, Willie. You're on the air. Hello, Willie?
Well, hello. Thank you.
Uh-huh.
My question is about the effects of the coronavirus vaccine on our young Black men and women, especially their reproductive systems.
Okay. Thank you, Willie, for the call. Keith, you want to address that?
Yeah. Right now, when you look at the data, it has no effect on the reproductive systems. A lot of people keep coming up with that. I don't know why, because you remember now this vaccine has been out for less than a year. I think right now, with November is when the Pfizer started to get approval, and but then it took till January to almost February before the rollout really started to happen with any sense of stability. So a lot. If you look at what mRNA does, and that's what I'm trying to get people to understand, the only thing this vaccine does is it's trying to get your immune system to respond. So and the focal area in which the response is around your vaccination site. So you get an injection in your arm. The vast majority of that medicine is there. That's where it goes, because it's working on those muscle cells to send a message to create that spike protein that is foreign to our bodies but common to the COVID-19 virus. And that's where the focal point is. So it doesn't migrate everywhere. And once the message is delivered, the body breaks down the vaccine quickly. So it's not even in your system long enough to really mount any long-term effects, because that's not the way this stuff works. That's what I'm trying to get people to understand. So it's not going to cause a reproductive problem as we know currently, and there's been no data. Remember, there's been millions upon millions of people who have been vaccinated, millions of them, and there's not any data that says that it causes a reproductive problem. It's just unfortunate. So Facebook and Instagram and TikTok and all that stuff has taken over the world with messaging. But if you really look at the hard data, and when I say the hard data, I don't mean that I think it's VAERS website. There's a vaccine reporting agency that if I can go up there, you could go up there, Barbara, and post that you had some effect from the vaccine. That don't make it so. That just means that's what you're reporting. So a lot of people getting information off that and saying, "Oh, everybody's dying from this vaccine." No, that's not true.
That's not true.
Okay. They can post anything up there they want to post. That's just for people to post it. So then they look at that data and they go back and say, "Okay, let's see if this was really what happened."
Okay,
So
I don't even want to tell people what that site is, because I don't want them going there.
I'm with you. But I'm just saying that a lot of people that have gotten this information are running with it, thinking that because it's reported there means that makes it so, but that's not the case. If you look at how many death certificates are going to say COVID-19 vaccine, you're not going to have hardly any, because there's not ever been really shown to do that. So out of the millions upon millions of doses that have been given out, even this issue with the myocarditis, that is think about what the virus does. The virus itself can cause myocarditis, and it happens a lot more with COVID-19 infection than it ever could with the vaccine. But you're talking about less than 1 in a million chance of that. Less than 1 in a million of the myocarditis. So I'm trying to get people out of this mindset.
The bottom line is there's risk in everything, but you've got to weigh the risk. And right now, the vaccine is your better bet. Let's go Let's go to Eric in Virginia Beach. Hi, Eric. You're on the air.
Oh, wow. Thank you for. I'm glad for listening. Thank you.
Thank you.
My question is, I've taken the Moderna So I've had my 2 doses, and they say that there's a booster coming out. Should I wait for a Moderna booster, or can I take one of the others as a booster?
Excellent question, Eric.
Yep.
Thank you for that question. Go
Very
ahead.
much so.
Mhm.
And I was give you a lot of credit for that, just asking that, because, and I'm going to tell you what's a little frustrating on my end as a physician. I have looked that up in a million different areas, and they are not clear about this. But this is what the CDC says, which is why I say this doesn't make any sense. But I know why. This is more of a legal issue than it is a medical issue. The CDC site says that, when it comes down to that question, it says that if you have received, like say, if you had a Moderna, by definition, you should stick with Moderna. If you had Pfizer, you should, by definition, stick with Pfizer. However, it also says that if, and this is in the same sentence, if you say you've been vaccinated and you're not sure what you got, you could take whichever one you want. And I said, what kind of sense does that make?
See, this is part of the problem, though, why people get so confused.
Exactly. But that is, I think it was more just the legality of it than anything else. So this is the answer. The short answer is, right now, the only people that are eligible for booster shots are if you're over 65 or have some, and have some chronic medical conditions that otherwise would put you at high risk. Those are patients with cancer, who are immunocompromised. Those are the people they're focusing right now on booster shots. Now, when it gets open to the public, we don't know yet. But what we do know is that when you compare Pfizer, and I had a Pfizer, and that's the one I got because I actually wanted Moderna when I was looking at it, but the problem was Moderna wasn't available when I had my first shot, which was the day after Christmas, actually. Mm-hmm. But what the data is saying is that if you had a Moderna vaccination, then your long-term protection is actually better with Moderna than it is with Pfizer. They're seeing a wane of the antibody response with Pfizer after 4 or 5 months. They're not seeing that with Moderna, and that's based on the delivery model. It's the same technology, but a slightly different delivery model in terms of how it gets in. Actually, the amount of the actual mRNA message is a little stronger with the Moderna one, which is why the antibody response was so robust.
Okay, so you just made me feel really, really good because I was worried because I have Moderna, and I knew we don't have that as a booster shot approved at the moment. But it's
right
coming.
Now,
right?
Right now, and I guarantee you, and the reason why the booster issue came out, now Moderna is still applying for it. They just haven't gotten their approval yet, but I'm sure they will get it. But the issue with the Moderna is just delivery was the reason that's the case. But I can guarantee you Moderna, is going to get approved. I mean, there's no way it's not. It's going to get approved by the FDA. But remember, Pfizer came out first. So the time frame that, the process, Pfizer was able to complete it first because they started it first. I guarantee you, with some exception, but I would almost guarantee that Moderna is going to be right on his coattails. Either October, no later than November, I bet you Moderna is going to be fully FDA approved as well.
Okay, so Eric can rest assured that if he decides to wait for Moderna, he will be.
Yes, he will be fine. I really do believe he will be fine right now because that robust antibody response is a lot stronger with Moderna than it is with Pfizer, and the data is pretty clear about that right now. Okay. Is that to say that Pfizer doesn't wane completely? Don't misunderstand. It's just when you look at the level of protection, it stayed 94% at 4-6 months out of Moderna, whereas at 4 months after Pfizer, it started to wane down to 70%. So, protection. So, I mean, it's still effective. It's just, it kind of shows that the Pfizer vaccine clearly probably will need that booster.
Okay.
Whereas the question about Moderna, you may not need it.
Okay. So we'll see. Again, everything is rolling. And that's the thing I think people need to understand is that because this virus is brand new, and we're trying to combat it. And so there are going to be changes and ebbs and flows, but we try to make sure that we stay on top of the most current information. Mary Alice joins us from Franklin. Hi, Mary Alice.
Hey, Barbara, how are you?
I'm doing great. How are you?
I'm great, thank you. It's so great to hear Dr. Newby back on your show again.
Aww.
Well, thank you.
It really is. And I tell you, I just want to commend both of you for the continuing coverage that you have given COVID-19 and COVID vaccines. It's so important.
Yeah.
Well,
thank you, Mary Alice.
I appreciate that, Mary Alice. I told Barbara she needed me back on this show.
You were right.
Oh, gosh, Mary Alice, it is so good to hear from you. Absolutely. One of our favorite Another View fans. She's been with us I believe, from the very beginning. So we really, really appreciate you calling in. Thanks so much for that
You're
call.
welcome. All right.
And if you're just joining us, we're bringing you the latest correct information about the coronavirus pandemic with cardiologist and health equity director for Sentara, Dr. Keith Newby. We're also in our fall membership drive with a $2,000 challenge. Let's check in with Dr. Barry Graham and Lisa Godley, see how we're doing.
We are well on our way, Barbara. I am very, very excited. For our $2,000 challenge, we've raised $1,465 thus far. So we are doing really, really great. And for those of you who have become new members, thank you, thank you, thank you.
Thank you. And let's get that phone number out there, 1-800-940-7170. Call in. That's the number to call to make your pledge of support. Barry?
If you value this program, and now let me echo what Mary Alice just said, more than ever, we need this program and we need this information out there. So thank you to everybody who has called in. And if you value what you are listening to, then consider contributing to it. If you think about the information that you receive when you listen to Another View, especially today with the topic that is, there's nothing more vital out there right now than getting the correct information we need. Thank you to Barbara, thank you to Dr. Newby, and thank you to Public Radio for providing this voice inside the community. We are actually now $435 just went up, $435 away from meeting the match. Yay. So one phone call at a time or going online to whrv.org. And let me echo what Mary Alice said. Once again, thank you. Thank you for providing this forum and for enlightening us and keeping us up to date like we need to be.
Well, I think it's just so important that we learn to take care of ourselves. whrv.org, that is where you go to make that pledge of support. Join our family, join the Another View family. You know, we talk about real issues and we don't pull punches, as Dr. Newby has not done the whole time we've been talking. We try to tell the truth. We tell the truth. We don't even try. We tell the truth about what is going on in our society today, what is important, and we appreciate your support. Lisa.
Well, Mary Alice has offered a challenge, too, which is incredible. She says for every new member who joins during the hour, she'll add an additional $50, no matter what their level, whatever level they join at. And if they become a sustainer, an additional $50.
Oh, that is fantastic. Thank you, Mary Alice.
So we have challenge times 2 going on here during this hour.
That's great.
So if you really want to make your dollars go far, go to whrv.org or call 1-800-940-7170. Let's keep those phones ringing. Let's get this membership drive, as stellar as it always is, because our Another View listeners always come through for us. Any last minute words you guys want to say before we go back to the show?
I just want to keep pushing our incredible gift of thank you and appreciation to folks. We do have Another View Black Lives Have Always Mattered to Another View T-shirts and sweatshirts for $10 a month as a sustainer for the T-shirt, or $15 a month for the sweatshirt. Welcome to the family. You have a fabulous, piece of attire to wear to show just how much you love Another View, because we love you.
Absolutely. So. And Barry, anything last minute?
Just very quickly, I really wish people could sit inside the studio, the control room, because when this program is on, we learn so much. Todd, Lisa, myself, we're talking and they're going, oh, wow, I didn't know that. And it's so amazing, the amount of information that, inside the studio there that we're listening very intently, just like people are outside, in their car or wherever they're at listening to the program. So I promise you, just an incredibly informative hour, and thank you.
Thank you so very, very much. Thank you to all of you who have already given. We appreciate you. Those of you who are still trying to make your way to the computer, now is the time. whrv.org or 1-800-940-7170. Dr. Newby, I'm back with you, and I want to talk to you about something that we talked about a whole bunch at the beginning of this pandemic that we don't hear much about now, and that's testing.
Listen, I was laughing to myself when you sent me that email last night, and I read it. I told my wife, I said, listen, I got to figure out how to answer that question tomorrow. Because I'm going to tell you, do you know how many people I've had call me saying they can't find anywhere to go to get tested?
Yeah.
I'm like, it's easier to get the vaccine than it is to get a test.
Exactly.
And I don't, listen, I don't know how to deal with that one.
Well, we do know that you can go to pharmacies, and I believe you can go to the health department also, but I'm not positive on that one.
Yeah, well, you can. The issue is getting an appointment. That's the problem.
Okay.
It's not what I'm finding is, and I've had some people call me. They say, I've called all the pharmacies. I can't get an appointment, or they can't get the results back for 3-4 days later. They're calling all the urgent cares, and a lot of doctors' offices aren't doing it. I know we're not doing it. I was looking into it, but the cost of the equipment was so cost prohibitive that we couldn't do it. So, the issue is just getting it. I had a friend of mine who was trying to, his son is less than 16, so had not been vaccinated, not because of anything other than his age. And he wanted to take him to a concert over the weekend, and he called me up. He says, dude, man, I'm having trouble. He said, I've called 4 different places. I can't, if I try to get a test, they say it won't be, the few places said they could do it, said it won't be till next week. I didn't know it was going to be this tough. And he says, I found a place, but they want to charge me $300.
Wow. Oh, my goodness.
That's what I said. I said, man, so that is, to be honest with you, although I am, all about vaccination, but it sounds like we've kind of left the testing part a little bit behind, and I think that's something that we may need to look at. How do we make this a little bit more of a robust situation? Because there are people that still need to get tested. Because even if you've been vaccinated, there are times where you're still going to need to be tested.
Yeah, absolutely.
And the saying it's out there is just the ability to get it is not quite as readily available as I would have thought it would be.
What about the home tests? Are they safe? Are they good?
I'll tell you, they're pretty decent. But this is the only thing with the home test. That's more of an antigen test, which means that, the issue becomes is if you're, say, asymptomatic and you're trying to, there's a couple of things with testing. Let's start off with this. If you've been exposed to COVID-19, there's no point in going immediately to get a test because the virus ain't had a chance to do anything yet. So you can go get a test. It's going to be negative in all likelihood. So the theory is, if you've been vaccinated and you get exposed, they want you, of course, you're supposed to be wearing our masks and stuff anyway. But if you're asymptomatic at, 4 or 5 days, then you say you can get tested, and you clearly is in your right to do so, and you probably should, but it won't be a shock if it's negative, but you don't have to quarantine, because you've been vaccinated. But you're still supposed to wear your mask and everything else. Now, if you haven't been vaccinated, you need to quarantine if you've been exposed. But the thing is with the home test, that's an antigen test versus the other types of tests they have out there. The antigen test, the problem with the antigen test is you need enough viral particles to make that work. So if say like you're asymptomatic, and they really don't recommend an asymptomatic patient doing an antigen test because there's a high likelihood that you won't have enough viral particles available to really show that it is a positive test. So they really want to, get you to hold off on that one and not necessarily take, the antigen one for that reason.
Okay, so if you're asymptomatic and you've been vaccinated, then the home test probably you will have trouble getting a true reading.
Exactly. That may not be the best one. Now, if you're symptomatic, that's a different deal. So the PCR test, that's the one that can find micro amounts of viral particles. But if the antigen test is more, you need a more robust amount of viral particles to test positive. So if you get a negative home test, that doesn't necessarily mean that you don't have COVID-19. Now, if you're symptomatic and you got a negative test, that's helpful. Okay. Because if you got like fever, chills, all this stuff now, but still, I would still say that even if you're negative, that doesn't mean you're out of the woods. So don't misunderstand, because I have seen false negative tests. So you have to be careful with that. I always say you follow up an antigen test. Like say if you're say you're symptomatic and you do an antigen home test and it's negative, I would follow that up with a PCR test, which is and that'll help give you that assurity that you have two negative tests, two different mechanisms in play.
Gotcha.
But of course, if you do an antigen test and it's positive, you're done. You know the deal.
Mm-hmm. Mm-hmm. Let's talk to Sharon in Norfolk. Hi, Sharon. You're on the air.
Hi. Thank you so much for this great information, Dr. Newby. And I'm Barbara.
I
just returned from a trip in Europe. We went to visit family members, my husband and I. We are fully vaccinated. We have to show all of that. Once we got over there, we went to a pharmacy. They got all the information from our vaccination card and gave us a QR code to go on our phone, which we had to show every plane, every train, every bus, every museum, every restaurant that we went in. My daughter-in-law decided, and she lives there, not to get vaccinated. However, every 48 hours, she goes and gets tested. Testing is on every corner, every shopping center, anywhere that she goes.
Wow.
That QR code is sent to her phone, and she gets a hard copy. And then it disappears after 48 hours, and she has to go back again. Disney World, she had to get tested before we went in because you either have to be tested or vaccinated. It gives a good choice for people, although I may not agree with it, that you still feel like you are around people who know what their status is or they're vaccinated. Help me understand why we are not doing that.
That is an excellent question, Sharon.
Why are you going to put me on the spot like that? Well, I would say this. I have a good buddy of mine who lives in Florida right now. He lives in Miami. And he and I were having that discussion literally probably about 3 or 4 months ago. Literally that exact same discussion. He's telling me, he said, dude, man, he said, every corner has a site you can go. And he was telling me how it goes to his phone. He says, I have no issue with getting tested. So, I may have a different set of views with the governor down there on some of his other stuff, but in terms of their handling testing, I cannot debate what they've done down there. I can't. I wouldn't even begin to try. That has been the most. For what he's
down
telling
in Florida.
My friend. Yeah. Oh, yeah. He told me that's like the most together program they have. They just got some other issues that why they got to do that down there.
So here's the question: then who do we talk to? Who should we send Sharon to? Who should we send all of us to say we want more testing? We want more options. Richmond. Okay.
Richmond, because it's VDH.
So our delegates and to the health department. All right.
That's to me. I think that's a very good question to ask.
Absolutely. Thanks for the call, Sharon. I appreciate it. So here's another question. So my husband is in Greensboro for a golf tournament, and then there's a football game on Saturday. Lisa at A&T, North Carolina A&T.
Okay. Yeah.
And Lisa is working on her plans for Norfolk State's homecoming. Here's the question. If you go to a football game, do you need to wear your mask, or should you just stay home and watch it on TV?
Well, I'm going to tell you, I ain't been many places in the last year. I'm going to tell you straight up. I've been fully vaccinated. I don't care. I don't trust these scenarios too much. And I went to an ODU football game the other day just because I was invited. Mm-hmm. And, I had my mask on the whole time, and I was only there for about the halftime, and I was out of there. And it's not that anything, I personally don't have that comfort level yet. That I feel that I could just, shed the mask. So if you look at the CDC guidelines, they say if you've been vaccinated and you go to an outside event, then you don't need to mask up. But I'm still wearing mine. I don't have that comfort level just yet. But if you look at the guidelines, they say vaccinated people. The problem is you don't know who's vaccinated. And who's not.
And that was what I was going to be about to bring up, because if you are at a football game, you're unmasked, you're vaccinated, you're unmasked. But if the person next to you is not vaccinated, and if they're carrying the virus, they're always talking about these breakthrough cases that happen to people who have the virus. So why isn't CDC? Well, you don't know why, but the point is, why aren't we more clear about exactly what we need to do in this situation, especially with this Delta variant?
Well, I tell you, when I told you the other day, and I told you I just let everybody know in the listening audience, I applied for a Master's in Public Health. I got accepted in Chapel Hill, University of North Carolina, Chapel Hill. Thank you very much. And I tell you why, and everybody tells me I'm crazy because they know I work like an animal now. They say, well, how you have time to do that? I say, I have time to do anything I think is going to help my community. Part of why I did that was I really had a problem with the messaging for this whole pandemic. It was not so much that I think what created some of the confusion and some of the other things was unfortunately so when you're in politics, that plays a factor. I think that's why I tell people when you're really, I think the CDC is on point with a lot of their recommendations, but their messaging could have been better. But I tell people, go to places like Hopkins, Chapel Hill. There's some places, I think in Kansas or some other university settings. They don't have any political affiliations that kind of guide their advice. They're just printing what the data says. And I think if you look at some of those sites, I think that can give you a clear sense. The messaging part, unfortunately so, I think, partly, we haven't had to deal with anything like this in years. If you think about it, I think Ebola was the last thing we had that was even remotely problematic. So the messaging, I think they just couldn't figure out, how to message this in a way that people understood. As a prime example is when I think I mentioned this to you the other day when we spoke, a lot of people, unfortunately so, when they were trying to convey out, just like with Fauci and these other people, they made a statement. But I thought personally the way they should have done it was to say, okay, based on what we know now, this. But pending further information, because I want to make sure it's clear to everyone that this is a new virus. We're still learning every day. So as we learn, we will convey information. So things may change as it unfolds. But based on today's data, what we know now, this is our recommendation. I think that would have gone over a lot better than the way they did it, because they were making these bland statements and they had to come back and change it, but they didn't,
further eroding the trust.
Yeah, exactly. So and that's the problem. But it was legitimate stuff because things did change because we were still learning. But I think when you convey it to the public, you have to leave some room for change because we're still learning about this stuff.
So here's a headline in the Richmond Times-Dispatch. Among 12 to 17-year-olds in Richmond, white kids have up to 3 times the vaccination rates of black children.
Yep. Not surprised at all.
Exactly. And why aren't you surprised?
Because what I hear on a day-to-day basis, because because unfortunately so, the second mistake I think was made was this should never have been made political, ever. This is not a political problem. This is a health problem, and that's where it should have stayed. That was a big, major mistake because what did that do? That set that seed of distrust. And because and why politicians gotten this anyway, I don't know. I'm like, you don't know anything about medicine. Why are you getting involved? I mean, to me, that should have been the experts that know this stuff and can figure it out to help make the recommendations. So unfortunately, so when you had that mistrust that started, that and there's already a history of things in our people that can lead to what we have now, which is a mistrust issue. And then on top of that, misinformation is the biggest thing. I think the lack of trust and misinformation that's coming out has been the bane of our existence, especially in the African-American population.
Very detrimental. So Pfizer is seeking emergency authorization to vaccinate kids 5 to 11 years old. Do you think that the vaccine should be mandatory for schools?
Oh, yeah. No
across the board? And then Suffolk is requiring its student athletes to be fully vaccinated before they can play sports. You agree with all of that?
Yeah, because you have to have the MMR. Yeah. And how many times you seen measles, mumps, or rubella anymore? But you still got to have that stuff. So I'm trying to tell them, listen, if you don't have a problem with getting an MMR vaccine, why you have a problem with the COVID-19? Everybody, the things I hear, it's too new. Yeah, it's going to be new, but that doesn't mean it's not effective. I'm already healthy. Yeah, you are, but that doesn't mean you can't get sick. I don't know what's in it. You don't know what's in that weed you were smoking last week either. You know me, Barbara.
Keeping it real.
Keeping it real. But you did that. You had no problem doing that, and I hear you. But the bottom line is when you see the devastation this stuff is causing out here, meaning COVID-19, not the vaccine, the COVID-19 infection, that level of devastation, I told you before, I think, I've had 60-plus people die of COVID-19 that I know about in my practice. And I don't know about the ones that I don't know about yet. But when you see it, and you see that devastation, and you see the way they die, which is not pretty, I said, forget that. Give me the shot. I'd rather take my risk there because I don't wish that on anybody. But when you have people, if we are so convinced that the vaccine is bad to the point that, I may have mentioned this to you previously. I had a guy in January who had COVID-19 in the hospital on a ventilator for 2 weeks. By the grace of God, and only by the grace of God, he came off that ventilator and was able to come in my office in March because I was helping take care of him when he was in the hospital. He came in March. I can't. I barely talked. I said, dude, with his throat up. He told me he didn't want the vaccine because he was scared what it was going to do to him.
Oh, my goodness. It's just...
Now, when you have that to contend with, I say, really? What do you say to that? I'm like, listen, dude.
He was on the ventilator, and he still doesn't want to get vaccinated. I don't know what you do with that.
For 2 weeks on a ventilator. He was in the hospital for a month. And then told me he didn't want the shot because he was scared what it was going to do to him.
Okay, we are down to about 8 minutes left in this conversation. So let's talk to Elena in Norfolk. Hi, Elena. You're on the air.
Hi. Thank you so much. Love your show. Love Dr. Newby. Love you. My pleasure. You have done wonderful things, both of you, for our community. What I needed was to ask if it were possible for you to speak a little bit more to the two features of this virus that people, for some reason, choose to ignore. One, that the transmission is by aerosolizing, and two, that initially we heard that 40 to 60% of infections and even people ill would be asymptomatic. And I think that fools people into thinking they haven't had it or people around them don't have it when those two things are so deadly.
Okay, let's let him talk. Thanks, Elena, for the call. And Keith, go ahead.
So her first point was what again?
The first question about it,
aerosolized.
Yeah, aerosolized. Thank you.
So it's a respiratory infection. So the reason, and what I want people to understand is the reason why the mask issue is important is when you speak, half the time well, I shouldn't say half the time, but a lot of times you're showering people. That's what and you think about it. Anytime you breathe, what's in your lungs comes out your lungs. I mean, when you breathe, simple breathe. I mean, you ain't got to cough, you ain't got to blow, you don't have to sneeze. Just simple breathing, whatever's in your lungs is coming out of your lungs. So if you have COVID-19 viral particles, you can spread that. Now, the reason the mask is important is you may have heard before that the mask is designed not necessarily to protect yourself, but to protect others. But I still like protecting myself. I have, in my mind, I know what the data says, but it gives me some greater comfort myself. But what you're doing is when you breathe, that mask is catching those particles that otherwise would go out into the air. So that's the reason why the masks are important. You really are protecting other people around you. So if everybody's wearing a mask, then everybody's protected.
Right.
Here comes Joe Blow wanting to come out here, and he don't want to wear a mask, and he's the one with COVID. He's spreading it all over the place. And those are the people that can actually pass this on. So an asymptomatic part, that is why, it's so important for the mask wearing and protecting yourself, because you can have asymptomatic infection. And God bless you if you do. But the issue is if you don't know you have it and you're not wearing your mask, what can happen? you can go and pass it on to somebody else who may be less fortunate than you are. Mm-hmm. So suppose you're asymptomatic, but you give it to the person who had cancer 6 months ago and has been on chemotherapy and is now immunocompromised, and you blow on that person, and then they subsequently get COVID-19, and then they go on to die. Yeah. You know, are you willing to take that responsibility, or do you care that little about your fellow man? I care about my community and my people, which is why I do what I do.
Absolutely. And just so those of you who are very, very clear, asymptomatic means you don't show any symptoms. I want to make sure. No, I mean, but I'm serious. Because you know what? Because people will say, well, what does that mean? I don't understand what that means. You know, I want to break it down because, you know, I am really at this point where this has almost become a crusade for me. Because I'm so passionate about our community taking care of itself. And it's not just COVID. I mean, it's a variety of illnesses that negatively affect the Black community in particular. And a lot of it is, as you have said many times, Dr. Newby, is because of our lifestyle and because what we choose to do and so forth. We got 2 minutes left. Talk about flu season. We need to get the shot?
Definitely. You need to get the shot because, again, now, and if you wear your mask, you know, last year, the flu virus is actually almost non-existent. You know, because people were wearing a mask, you know, so we weren't passing anything on. People weren't catching the flu, you know, really. But I still say, because this is the thing, you can't have 2 infections at once. So if you get the flu, your immune response is already compromised because it's steadily fighting the flu. You get COVID on top of that, that ain't good. I don't know another way to put it. So I personally am advocating any vaccine that you can get. And I want to emphasize to people, vaccine is not a negative word. The vaccine is not an enemy of the people. You know, stop saying that. It's not. There's no reason for that to be. Because I'm going to tell you, and we have killed each other so much, and you know what I'm talking about, Bob. We don't need a vaccine to do that. All you got to give people a gun and motivation. And they can do that on their own. Our job is to protect our people and our communities. Whoever you are, wherever you are, I don't care. You white, black, green, yellow, I don't care. What I want is the people to be protected going into this because we are one America, despite what somebody else may say. We are one unified people that's trying to survive.
Absolutely.
And that's what I want people to remember.
In the last 30 seconds, where do we find your Facebook Lives? They will be on Facebook where you do your seminars?
Oh, yeah. Okay. Well, I will send you the link. But if you go to the Newby Foundation, newbyfoundation.org is where you can always register for when I do my Crucial Conversations with Dr. Keith Newby. And that is a Zoom Live thing we're doing. And that is we're bringing up topics. We did it on COVID-19 recently. I had my brother and my niece up there with me because both of them are MDs. Yeah. And we just had a real conversation about COVID-19, the vaccine, what have you. So it will give you just a little bit more information. So newbyfoundation.org.
All right, Dr. Newby, we'll see you next month. Thank you so very much for joining us. We appreciate it. Lots of information to keep you safe on today's show. So listen to it again or share it with a friend. Find our podcast at anotherviewradio.org or any place you get your podcasts. Lisa, do we have some numbers?
We do, Barbara. We have some numbers. We raised $2,080.
Oh, fantastic. So we made our match. Yay.
Absolutely. Thank you all very, very much. We really appreciate it.
Oh, that is fantastic. Thank you to those of you who are brand new members, those of you who are coming back to us as members, those of you who are sustainers who decided to up your membership. We really appreciate it. And you don't have to stop because all day long today, I am on the radio asking for your support. 800-940-7170 or WHRV.org. Next week on Another View, what the church can do to stop racism. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Thanks again so much for becoming a member of WHRO Public Media. It's not too late. 1-800-940-7170, WHRV.org. Let's get together again next Thursday at noon for Another View.
Support comes from Thomas Nelson Community College, the first choice to start a career. At Thomas Nelson, gain skills to succeed in fields like cybersecurity and education through short-term training and 2-year degrees. More at tncc.edu/firstchoice.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.